Besides the four big, there are other clinical features which are manifestations of the four main features that I described in the previous slide. They are micrographia or small handwriting, hypophonia or reduced volume of speech, hypomimia, meaning the facial expressions become less, the shuffling gait of festination, where the stride is small and people seem to shuffle in baby steps or small steps. There is excessive saliva secretion and saliva may drool. In the advanced stages, people can have difficulties in swallowing and autonomic dysfunctions like the postural fall of the blood pressure, changes in the urinary system, and so on and so forth. And like I told you in the last slide, some people have depression and dementia. What is the pathophysiology of Parkinson's disease? It is due to involvement of the basal ganglia. Within the basal ganglia, mainly the substantia nigra and the globus pallidus, where there is a depletion of the dopamine in these structures. And there is an imbalanced cholinergic and dopaminergic transmission. And here you see the circuitry involved in this process. Now, please remember that Parkinson's disease is the prototype of these diseases. And on the left, I am reiterating the cardinal features: the resting tremor, rigidity, bradykinesia, postural instability, and another one I am adding here: positive and long-lasting response to levodopa. These 5 features are cardinal in Parkinson's disease. But please remember, what looks like Parkinson's disease can be another syndrome that simulates Parkinson's disease called Parkinson plus syndromes. And these syndromes have poor or short-lived response to levodopa, prominent autonomic dysfunction, dementia, ophthalmoplegia, amyotrophy, dystonia, depression, and ataxia. So these are sort of red flags to say that if one of these or more of these are present, then you may not be dealing with atypical Parkinson's disease. Now this slide shows you some of the common Parkinson plus syndromes. Progressive supranuclear palsy, where you have the vertical gaze abnormalities and axial dystonia. The CBGD or CBS, corticobasal syndrome, where you have extreme asymmetry, useless hand, sometimes the alien hand. These two are commonly seen. The third is multisystem atrophy, where autonomic dysfunction is the dominant feature, along with a Parkinsonian or a cerebellar syndrome. And accordingly, multisystem atrophy is divided into MSA-C, meaning cerebellar, or MSA-P, meaning Parkinsonian. So there is typical Parkinson disease, and there are Parkinson plus syndromes, and one should identify the red.